Hello, my name is Genesis Maldonado. I'm an internal medicine intern at McNeil Hospital. I'm here to present you this project I did before starting residency titled COVID-19 Pandemic in Ecuador: City Patterns in the Absence of Access to Screening and Diagnostic Testing. Back then, Ecuador was also affected by the pandemic in March. The lack of preparation and awareness had a negative effect on hospitals in the city of Guayaquil. During those months between March and April, the scarcity of resources and access to screening tests was really a problem. So, in the setting of this situation, we decided to admit patients with aggravating symptoms and perform CT chest without contrast to the patients with symptoms. The purpose of this study is to identify the CT patterns in Ecuadorian patients with clinical suspicion of COVID 19 with no access to screening and diagnosing tests. The methods were: this is a prospective observational study conducted at the Kennedy Alvarado Clinic in the city of Guayaquil. The patients were included based on inclusion and exclusion criteria during the months through March and April, and the radiology criteria for COVID diagnosis was based on the recent guidelines published by the Society of Medical Radiology from Spain. The data was analyzed in the SPSS version 23, and the difference and correlations between the variables were analyzed by the Fisher test and also the ANOVA. We consider statistical significance with a p-value of less than 0.05. The results: we gathered 191 patients in this study. 35% were female and the rest were male. The mean age were around 51 years old with a standard deviation of 15. You can see in the table 1 the demographics. Based on the characteristics of admission, the duration of symptoms were approximately 2 weeks. We don't have widely availability to the PCR. However, some institutions had it, and some patients could access to those testings. From all the population, 94% of them didn't have access to that, so that is represented also in the table. Regarding the site of admission, mostly they were walk-ins in 28%, and also directly through the emergency department in 38%. ICU transfers and 7.3, and generally from the floors 25%. The diagnostic suspicion of these patients was highly confirmed in 180 patients. No suspicion of infection, only 2 patients. Regarding the city patterns of Ecuadorian patients with suspicious of COVID infection, we had as a CT pattern the ground glass opacity is in 87%, the alveolar pattern in 2%, crazy paving in 31%, and pneumonia characteristics in 31%. At the end, the criteria can establish based on the patterns if they have a final diagnostic impression of suggestive, undefined, or not suggestive diagnosis. So, based on that criteria, we managed to classify the patients. So, as you may see, 96% of the patients that we did a CT had a final diagnostic impression of suggested COVID symptoms. That could also be represented of the algorithm in the figure 1. So you may see that 191 patients with flu-like symptoms that we admitted, we did the CT chest, applied the serum criteria, and we see that basically 95% of the possible 91% of the whole population have positive COVID symptoms, COVID diagnosis based only in the CT changes in the setting of the unavailability of the diagnostic testing. So currently we have more data about it, but the more common patterns that we are seeing in COVID patients are ground glass opacities, alveolar pattern, crazy paving, and like pneumonia-like characteristics. Our conclusion of this study was that almost 96% of the Ecuadorian patients that we admitted at that time showed CT findings indicative of COVID 19 infections. These CT patterns consist in the presence of opacities, alveolar pattern, crazy paving, and pneumonia characteristics. This was really a simple study that we recreated only based on the CT images that we get. One of the limitations was that we didn't have access to all the information of these patients because of the substantial amount of work we had to do at that time. However, I really want to show this data to you and highlight the importance to really recognize patterns in CT of patients that have suggestive symptoms of COVID. And in the setting that we are entering cold winter season, we have to identify also another type of exclusion diagnosis. So if you have any questions or do you have any comments, you could put them below, or you could address obviously to the correspondent email on the bottom part of the poster.